Uh, Good evening, everybody, and welcome to this program from AIG Hospitals. Over the last few months, we have seen a pandemic which is sweeping our country. The second wave has dramatically increased not only in terms of the number of patients, but the number of more serious cases and also deaths. What is happening simultaneously is that there's been a lot of myths, rumors going around in the social media. Public are getting confused with all this variety of information they are getting, and this is leading to a lot of fear and also a lot of despair among the population. To counteract this and also to start an education program for doctors, AIG Hospitals has launched this new series which is in two parts. The first part is going to be the launch of the information booklet for patients. In a simple way, we are going to tell what they require to know and what they have to do, which is very scientific based. Over the last few months, AIG Hospitals also had some very talented consultants who have been treating about 20,000 patients of COVID, and based on this experience and based on the evidence that's coming to the literature, over the next 1 week, there's going to be a series of lectures from these consultants, which are going to be compiled together as a book, which is going to be distributed to all the practicing physicians. I think this will be extremely useful because this will be both evidence-based and experience-based, and this would result in better practice of treating patients with COVID. Now, to inaugurate this program, to initiate this process, we are extremely glad that we have with us our chief guest today, this evening, Vishwanath Sajjanar. Vishwanath Sajjanar is the Commissioner of Cyberabad Police. He is not only known very well among the public, but I think he has been one of the most outstanding police officers we have had in recent times. He is my personal hero, the way he has dealt with many of the crimes and how he has given confidence to the people in this city. I think I remember some patient telling me very late in the night when I was seeing him in consultation, said, "Is it safe to go back?" He said, "You are in the area of Mr. Sajjanar, it's very safe." So that's the confidence people have developed because of his presence. We are extremely honored that he has agreed to be a part of this function, to first inaugurate this patient booklet and then of course initiate the series of lectures that are going to come. Thank you very much, sir, for being with us this evening. Thank you. We request him first now to inaugurate this booklet, and then he'll deliver his address. You just have to. So these booklets contain all the information what the patients or the attendants want to know. This will be both print media and also it's going to put up electronically in our website. Anybody can go and get this information. Very useful information is given on how to isolate yourself in the home, what type of medications you can take, when should you contact the doctor, how to check your oxygen levels and so on. Thank you very much.
Thank you.
We request you to.
Yes. Respected Chairman of AIG Hospitals, Dr. Nageshwar Reddy sir, Director AIG Hospitals, Dr. G.V. Rao sir, and all the respected doctors. Good afternoon, everybody. First of all, congratulations to the team AIG led by our Dr. Nageshwar Reddy sir and the staff, doctors and all, for doing a great work during the first wave of Corona. Myself, I have seen how they have worked for almost 5-6 months. Then also similarly during the last almost 1 month, the entire team AIG has been doing a great work. So first of all, congratulations and appreciation to all the team AIG. Second wave has come very suddenly, whereas in the first wave we had ample of time, because even though the wave started somewhere in the last week of January, in the last week of December, then almost came to in the month of March, then we had lockdown, then we had series of events where a lot of awareness was brought among the people, and because of the efforts of the doctors and all and the hospitals, we could overcome that first wave. But the second wave came very suddenly, and during this time the doctors, the hospital managements, the staff, everybody were stressed, even though with lot of hurdles. Doctors and nurses and the staff have done a great job throughout the state and throughout the country. So my congratulations to all the doctors, the hospital managements and the staff for doing the great work, because we work very, very closely in Cyberabad, sir. Almost about 10 lakh people work in this corridor, about 5.5 lakh our IT employees and the supporting staff and the hospitality staff and all. So we work very, very closely, and during the last 1 month has been a very, very horrible time, sir. My day ends with a bed and starts with a bed. People keep on calling us because we work very, very closely with the IT industry and through our Cyberabad Security Council. So even though people are aware of lot of people educated also are aware of the disease, but still there is a lot of panicness. Everybody has the habit of Googling now. They ask the Google Baba, what should be done? My saturation has come down. Others, what type of tablets has to be taken and all. And also similarly, there is a lot of misuse of social media. That has also caused a lot of panicness. People don't know when to get admitted or what should be the stage. Even though in the case of mild also, they are very, very panic. So there is a need of information, right information. So with your two initiatives, I think that vacuum has been filled, sir. Congratulations for you to bring out a booklet. I have seen the booklet. It is well documented, scientifically based. So congratulations, sir, and to the entire team for bringing out a booklet. My request is, sir, that bring it in also local languages, because AIG is a world famous, world class medical institutions. Electronically, I think even though it's printing it language wise, it might be, but at least in various Kannada languages, Marathi, Tamil also, you can put it in electronically, sir, so that people can access it and people can know it. So many of them will not be having that access English and all, sir. I think because I've seen in 2-tier cities also, there is a lot of misinformation. Some do, because people, different areas, different protocols. Here we have one protocol, there they have one protocol. So I think with this document, I think that vacuum can be filled, sir. And also there is in the second series, that's also a very, very good initiative, sir, because a lot of doctors are also tired and they don't know what is happening scientifically also, what is the research going on, how the virus is moving. I think with your series of lectures by experienced doctors, sir, I think the doctor fraternity also will be immensely benefited, sir. I think it will be not only benefit but also all over the country. I think it's open to all, no?
Yes, yes.
So I think it will be benefited the entire country. I think wide publicity should be given, sir. So we from Cyberabad Police and Cyberabad Security Council, sir, because Cyberabad Security Council is a 15-year organization, sir. We work very, very closely with the IT industry, not only in the part of Telangana, but also in the part of various part of the country, sir. This organization was started way back in 2006, sir, when our present DGP was the Commissioner of Police Cyberabad, sir. From there we have taken up, sir. So I think we are also willing to associate with you, sir, if there are initiatives or if you want our help, sir. So we'll also associate and we'll try to bring awareness among the public, sir. It's a very, very good initiative, sir. I think people also should make use of it and should know it. We, on behalf of Cyberabad Police and Cyberabad Security Council, sir, we thank AIG also, sir, for associating with us in the telemedicine facility, sir. That also a lot of your doctors are also associated, sir. Our health vertical in charge, Raju Menon, sir, is our cardiologist here, sir.
Yes.
He has been the guiding force behind our all medical interventions, sir, and medical initiatives, sir. So that initiative and also launching of ambulance we have done, sir. So we have almost launched 16 ambulances, sir, for the needy people, sir. So almost we have got, sir, and also we have been organizing this plasma donation, sir. So people, because that's one area we thought initially, sir, that would have led to a lot of commercializations.
Yes.
Like you must have seen the Remdesivir and the Tosi things,
Yes,
sir.
yes.
So initially people, without knowing also, they took plasma for lakhs of rupees, sir. Then we found that whatever worth it is, sir, that we should start this one, and we almost now 20,000 people have been benefited, sir. Almost about 10,000 donors have come forward and they have given plasma, sir. So it has helped us immensely, sir. Then we started this telemedicine facility, sir. We also started this one child care center, sir, for the parents who have been affected with COVID, but children not affected with COVID, sir. So we have launched 3 centers here, sir, in this one, sir. That also we have launched, sir. So we are willing to associate with AIG in any of the initiatives to bring awareness among the public, sir. That is the need of the hour, because many of the people I have seen, they are not at all aware how to go about. And main thing is that even educated persons are going for self-medication.
Yes.
Over the counter, they are going and asking medicines. Yes. People are also giving in the rush, they are giving the medicines without knowing what is the stage of the disease. what should be done, when should the X-ray be taken, when should the HRCT be done. So everybody without any this one, sir, they are going and taking medication. I think with this initiative of launching a booklet, I think that vacuum will be filled, sir. So I once again thank Dr. Nagaswara Reddy sir and the Dr. G.V. Rao sir and the entire team of AIG sir bringing out this booklet, which will be very, very useful for the common public, and also launching a series of lectures by senior doctors. So only my request to all is to make use of this booklet and also of the medical lectures, so that you can also treat scientifically with scientific based research and all. So thank you, sir, for inviting me for launching these two initiatives. Thank you.
Thank you very much, sir. I think we appreciate your very nice address and also the work that's been done by Sabarpad Police in this COVID situation. We have already seen this work by ourselves, especially the plasma donation, what you talked about. I think is a fantastic initiative, which is very, very important. We are also, I think, as you suggested, we'll make this booklet in different languages. This is a very good suggestion that we have. I think I'll ask G.V. Rao to say a few words, and then we'll open to the press. There are a lot of press who want to ask any questions.
So on behalf of the team AIG, we profusely thank Sajjanar for sparing his time for this noble cause. We know the firm stance that you take in dealing with various matters. You are known everywhere actually, and you are also known for the firm stance that you have been taking for the COVID norms.
Yes, sir.
And which have been very effectively implemented. Thank you so much for that firm stance that you have been taking and taking your time off to spend some time with us. And also at the same time, you have been very kind to the public, attending to their public grievances actually with a human touch. Thank you so much. Actually, the entire social media is full of appreciation for you.
Thank you, sir.
We are very thankful for you to have you here.
So I also thank, sir, because many of my own friends, relatives have been treated by AIG, sir. All of them have come successfully out, sir. They are hale and healthy, and whenever I request Capri and the team of doctors, sir, they are very, very helpful and they are taking care, sir, which I find not finding in many of the other hospitals, sir. But here I find that there is a lot of human touch and personal care is taken regarding all the patients who are there in IIG now, sir.
And for the first time, we have had this crisis in the medical history. But actually, thanks to all the scientists, epidemiologists, clinicians who all came together, and I think this is the first ever time within a short period of time we understood the disease and we are also treating the patients. First ever time it has happened in the medical history, and it is showing very good outcomes actually. And thanks to the virtual media that we have, that actually we are able to interact with people across the globe, and protocols have been set right now and effectively translated. And actually, under the tutelage of Dr. Reddy, we have a very good basic science department that has helped us understand a lot of this disease, and we are able to manage a lot of these patients in different manner, and also thanks to a contribution from all our faculties who have got innovative ways to treat these patients, which are getting into protocols of international management. So we thank all the staff here, the entire team, not only the medical team, the paramedical staff, the nursing staff, the administrative staff, and the GDS staff who have been working 24/7 to serve these patients. And once again, I thank you profusely for sparing your time for this. Thank you so much.
Thank you. If any media persons, I think we have a lot of media attending, they would want us to interact in any way, we will be glad to do so.
మ్యూట్ చేయలేదు, అన్మ్యూట్ చేశారు వాళ్ళందరూ.
Unmute
చేయండి వాళ్ళందరిది.
I think they are asking, we are not able to get in the question.
అన్మ్యూట్ చేయండి.
Sir, I am a regular customer of AIG, and I have a small question to ask. Can I ask, sir?
Please.
Please, sir.
Yeah, sir, if a person is having COVID, is asymptomatic, and second dose if he takes, will it affect, if he doesn't know that he's having COVID and he takes the second dose, what is the consequence?
No, that's a very good question. If somebody is asymptomatic, he doesn't know and takes the second dose vaccine, there's no harm. What this vaccine will do is it will produce immunity to that person. Booster dose will produce more immunity, and the antibodies that are there not only because of the vaccine but because of the virus infection will increase much more than normal. So there's no harm. But if you know already that you have COVID, if you have taken one dose of vaccine, it is better to wait for 4 weeks after the disease has subsided to take the second dose. But by mistake, if you take the second dose during this COVID also, no harm is there.
Thank you, sir. Thank you. Kind of.
Hi, this is Ritika Mitra from the New Indian Express.
Hi.
Yeah, hi, sir. Want to know, will the protocols be sent to our respective email IDs for us to have a look? Also, how are the protocols different from the ones already issued by the Ministry of the State Health Departments, and in what aspects do you think it will stand out?
What way is it different from the other protocols that is?
Yes. So that's also a very good question. The protocol, there are several protocols. We have protocols coming from two major institutions in the country, All India Institute of Medical Sciences and CMC Vellore. Similarly, we have had protocols from Mayo Clinic, Mass General Hospital, Cleveland Clinic, and so on. These protocols vary based upon the local pattern of the disease, the local practices that are occurring, and also about the local awareness of the people. Our protocol is based on not only the scientific evidence that's available in literature, because it keeps changing very dynamically, but over the last few months we have had experience of treating 20,000 patients of COVID very successfully, with one of the lowest mortality in our hospital, in overall the country. We have some brilliant consultants, both in internal medicine, pulmonology, and cardiology, looking after these intensivists, also looking after these patients, and they have devised some of their own studies which are going to be published soon. For example, the unique use of methylene blue for treatment for lung diseases. Similarly, the careful use of steroids, which are rampantly being used, which we are being very careful about how they should be rationed. The need of timing for using remdesivir correctly. All these things are putting in proper perspectives. With the wisdom that we have had in treating these patients, with the evidence in literature, this distilled wisdom is going to come in a form of a book, which is going to be soon given to all the physicians practice, so that evidence-based medicine can be practiced.
Also, sir, are you planning on collaborating with other hospitals, since you already have had very good results and scientific results, empirical studies, as you're saying? So, are you planning to collaborate, and are you planning to collaborate with any of the state health departments? How would you kind of scale up your studies?
So, we are already collaborating with many of the hospitals. In fact, we are in constant touch with all the institutions, exchanging ideas. We have cross-institutional seminar almost every day with the different institutions, not only in our country, but all across the world. Every day we have one international seminar where, say, with Harvard or with Mayo and so on, we're interacting, giving our experience, they give their experience, and some many Indian institutions. We reach out to almost 3,000-4,000 doctors at a time with these protocols and with this experience that we are having. So this is going on a daily basis, and this is very important, because exchange of knowledge, I believe, at this time is very important. In fact, many times it can save lives. For example, treatment of these patients with a special type of antibodies can be life-saving, and again, this knowledge comes very rapidly. We can tell people how this can be done in a proper way. So, and now of course, you know that sometimes overuse of steroids are producing fungal infections, mucormycosis, which are seeing in large numbers. How to avoid this? We have made protocols how to avoid this, and all these important facts are being discussed every day in seminars, webinars that we are conducting.
Right. Thank you so much, sir. Also, is it possible to send across the protocols? I've left my email ID on the chat.
Sure. We'll do that, definitely.
Thank you so much.
Doctor?
Yeah.
Doctor, this is Kumar Sharma. I'm Deputy Editor with FP Digital, the Indian Express Group. Congratulations on an important initiative at a crucial time, really, and very insightful talk by you and Mr. Sajjana. The question really is, the problem today is most patients are actually, it's left on the onus is on patients to scurry around for beds, oxygen, medicines, and all of that. Is there any way in which you, of course, you must be having some protocols in the way hospital actually sources the medicines and the various things which patients need, and your view in terms of how this issue can be handled so that the onus is not on patient, which is leading to all sorts of problems really, and actually it's hospitals which actually coordinate this and ensure that, you know, patient just gets in there and then rest of it is actually handled by the healthcare provider.
I think we'll ask Sajjana also his views on how we should coordinate patients going to hospitals so that they're given, because this problem of going to the hospital, no beds available, staying in the ambulance, all these things are there, and this is an administrative problem that has to be solved by the society itself. I think Sajjana would
So on
talk.
behalf of Telangana government, I would like to say that a lot of beds are available in our teams as well as in the Gandhi hospitals. But the problem is that people doesn't know when to get admitted. They deteriorate, or when the saturations go down, they come running to the hospitals, not only to these hospitals but also other hospitals. I think, as sir was telling, that this booklet will really help when to get admitted, what should be watched, because I've seen young people without watching their saturations, without knowing their oxygen levels, they deteriorate. When they reach about 80, 85, then they get panicked and they are trying to find the hospitals. That is one problem we are saying. So because of that also, there's a lot of panicness, and because they reach the hospitals at the last moment when all the beds are full and all, so that one problem is there. The second thing about this remdesivir and all, I think many of times we have seen that even though when the patients do not require, but many of them are recommending for it, and that's also creating a lot of scarcity. But now the government has made a lot of efforts to see that the remdesivir is available in all the major hospitals and all. And regarding the TOSI also, the Cipla drug also, I think government is closely monitoring. It is also given to the patients who require only. After the team of doctors recommend for it, then the medicine is being released. So government and the police department are making all efforts to ensure that all the medicines and all the hospitals are properly managed.
Yes, I think in that way Hyderabad is lucky, because there's some coordination, especially the police coordinating along with the government in seeing that people are distributed to proper hospitals. Ideally, what should have been that all the hospitals should form a network, and in the network there should be a common source where people can go into a website or some to see what is available, what type of beds available, what is the cost available. This is a problem with this. It's very difficult to do it. Even in Western countries, advanced countries, in US, in UK, they have not been able to do this. It's very, very difficult. This pandemic has taught us a lesson that at least for future we should be prepared. Some of the hospital managements, we are all talking together, making a complete network, and if you enter into the network, you know what facilities are available at that particular point of time, how many ventilators are free in that hospital, whether there is facility for oxygen, remdesivir in that particular hospital. So if all the hospitals in Hyderabad can come together and form this network, it will be extremely useful. But I think we have to reserve it probably for the next time, because it's too short. All of us are so busy now.
We tried, sir, but somehow because of it came so sudden that we could not plan, sir. Actually, we thought of doing it, sir, but somehow it came so sudden, and it was dynamic also, sir.
Yes, sir.
Because the people were waiting for beds, and even they could announce that yes, a bed is available, already a patient was waiting for them to get into that ICU bed or the ventilator.
So I think in such a huge pandemic, it's very difficult to plan.
Very difficult, sir, because the time was also very, very short, sir.
But for future, I think this is an
I
idea
think we should, it's a
should
good idea, sir, that we can all come together and network.
Yes,
I think Bangalore, they are trying, sir, to put it in thing. I think we have to see how the result is.
Yeah, but they tried in Delhi also, it didn't click,
Sir.
so it's very difficult.
Okay, thank you, doctor. Wish you best. Thank you so much.
Yeah. I think if there are no more, we'd like to thank all the press for attending this function, and also especially Mr. Sajjana for being here this afternoon. I know he's extremely busy with so many things in the department going on now. We're extremely thankful to him for being with us.
Thanks.
So that this project will become a success. Thank you very much.
Thanks.
Thank you.